do a quick welcome for everyone. Thanks for showing up. And for those of you who might be like, oh, I have a partner who wants to see this or a colleague, we are recording the webinar. So we'll have a link to that so people can look through it. This has been a long time coming for those of you who were paying attention on our Tuesday topics or talked to our staff. We thought we were going to be able to roll this out in February, but little did we know that the state of Minnesota just has a really long contracting process, even for licenses. So Michael and I have been working basically since December to get this in place, and we just got it in place probably about 3 weeks ago, where it was official, where we purchased it. So thank you for your patience. We're sorry it couldn't roll out. You're welcome to call the governor and talk about our contracting process if you are so inclined. But we have 400 licenses. As of this morning, about 90 people have signed up, so we have plenty to give out. And I know a bunch of you who are on who are like, well, you're trying to decide. That's fine. Just know that we still have quite a few licenses to hand out. We are asking, because the taxpayers are paying for this, we are asking people to make a commitment to try and use it. And we've given some guidelines of that. It would be about one course per quarter, if you think about a 3 month as a quarter, and ideally one webinar. And that's just because, we have a service, we've paid for it, we might as well try and use it. You can certainly be a gung-ho person and take all 12 courses and all the webinars. That's wonderful if you want to do that. Time is probably going to be the issue, so we're just asking everyone to strive to take at least one. And if you have to bunch them up in one quarter or whatever, that's fine. But I have been guilty myself of signing up for things and then just not using them. And since we did pay for the licenses, we just want to make sure that people are using them. So we do have that application process, and you're saying you agree to try and commit at least. And then really, Michael's going to go through a demonstration of how the site works, how you'd, register for a course and the thing, what's on there. We're not going to go into, this webinar won't be an in-depth of the content of all the courses. So we've already sent out the list of description of the courses. If you guys do have more questions about that, you can certainly follow up during the chat time at the end, or you can follow up with us or Achieve OnDemand. If you're just like, I don't even know who I should refer to this, we can certainly answer those questions. So I think, and then hoping our system works right, all of you who have already been approved, and you would have received an email that said your license was approved, at 10:30 this morning, you should get an email that will have the actual URL of the Minnesota's portal. So what Achieve OnDemand is, they make a portal specifically just to Minnesota. And so that should come through your inboxes around 10:30. If you've been approved, you would have already received an approval email. And so if you're going to sign up afterwards, you'll get it at a later point. So however, I think the site is not going live until the webinar is done. So please listen to the whole webinar. Don't try and sign in the minute you get it. Just wait till the webinar is done, and I believe Michael is opening the portal then. And then the only other comment I have is all of us live in a life of logins and passwords, and also just navigating sites. And you certainly could lose your password, or you might not remember how to log in, or you might be having trouble, or maybe you have a glitch. We part of our contract with Achieve OnDemand, why it was so enticing, is they will help you. So you can, I would recommend on the login page, their email and their phone number is right there, and they're your first point of contact. If you write to our staff, we'll basically just refer you there, because we don't control any of the portal site. They are the ones who can get you your password, help you log in, figure out why your video isn't showing, or why you registered for something, it didn't work. I mean, we're expecting everything to run smoothly, but things always happen. So they're your first point of contact if you run into problems with Achieve OnDemand. And with that, I think we're just excited to have everyone on board. We think this is a really good opportunity, because it's we know that people want, the number one thing when we ask about training is people say they want more mobility, so they don't have to drive places, and they want face-to-face, which is always a challenge because we have a large state. So this is sort of a good compromise in that it's a lot of self-paced online courses, but the webinars are more in real time and sort of that live training. So we're hoping that it meets people's needs. We'll probably be checking in sometimes over the year just to get your feedback of how it's going. And everyone has, whenever you get your license, we're making it good for 1 year. We actually bought 2 years worth of licenses, so we'll then see, like, is everyone using it? Does anyone want to, like, they're done, or we'll transfer it. We'll figure out about this time next year what we do for the following year. But for right now, you have it for a whole year, and we can't transfer it between people. So if you leave your agency, you'll have to update your email, but it goes with you, so that it's not belonging to the agency. So, all right, I'm going to turn it back over to Michael.
All right, sounds good. Thanks, Dawn. And I do want to reiterate, as Dawn said, one of the most important points as we go through this is our Achieve OnDemand support team is available to assist you. So if you run into any issues throughout the process, you can contact us at achieveondemand@theounce.org or via our hotline of 312-481-8858. And I posted both of those into the chat here. And as Dawn mentioned, this will be on the registration page as well. And we also do have support guides that I'll share with Dawn, and we can share out to everyone to support with any of these processes that we're going to go through. So, we've tried to make this as streamlined as possible, but we also want to make sure that we're providing support to help you get into the system and get into the professional development that will help you out with the important work you do. So for today, we're going to do a brief, I know Dawn's already shared out a lot of the information about what is in Achieve OnDemand. I'm going to give a very high-level overview of the two primary learning experiences you're going to be engaging with in the system, and then we'll move into a demo that's actually going to walk through the process, and I'll just be sharing my screen and showing you exactly how to navigate through the system and get to all of the elements within it. At the end, I'll share some frequently asked questions, and then we'll open up for chat and discussion. All right, so to start off with, in Achieve OnDemand, the two primary learning experiences that you'll be engaging with will either be self-paced courses or webinars. And sometimes it's a little tricky online to figure out what the difference between a self-paced course and a webinar. So from Achieve OnDemand's perspective, self-paced course, these are multimedia self-paced items that you can work through on your own. So basically, you'll register into it. It's something you'll work on your computer. You'll go at your own pace through it. Each of these averages about 3 hours of professional development per course. A few of the courses may take you a little longer. They may take you a little shorter. It's really going at your own pace. Some of the longer ones will just be longer because they have more video elements in them, but those are kind of exciting and fun. Like the pregnancy course has a lot of demonstrations of how to do fan activities. So while it's a little bit more expansive in terms of the content, it's really giving you a lot of references you can come back to or work through the first time and then come back to as you have access to the course, which is also a note here. You do have access to the training even after you've completed it. So with regard to those videos, if you finish, say you got through the pregnancy course, 6 months later you're working on stuff and you're like, oh wait, I remember there was a really good fan of video in there that covered, some soothing activities or sound enrichment for the baby, and I wanted to go back and watch that. You can actually go back into your transcript, pull that course up, and jump to that video to watch it. With regard to the webinars, the difference between that and a self-paced course as a webinar is a bit more of a peer learning experience. We actually have a OUNCE resident expert in the field of home visiting and in training who facilitates that webinar. Since it is a live session, it is scheduled on a specific time and date, but we do record the sessions. So if you sign up and aren't able to make it, we can get you the recording of the session. And we do also run it several times throughout the year, and we run these every year. So it's if you really want to be part of the session, we definitely recommend attending these live because that'll give you the opportunity to engage with the facilitator and with your peers both within the state of Minnesota and nationally. but we also understand schedules can be tight, and we want to make sure you're able to get to the training that you need when you need it. So we will record those and can make them available. All right. So with that being said, we're going to go ahead and get started with doing a walkthrough of the logging in, enrolling in your courses, accessing your completion certificate, and how to get user support. Once again, this is really a visual walkthrough and we're recording this, so this will be available later if you don't catch everything as we're going through. We also have support documentation that will be made available that can guide you through these processes as well. And the other way to go is if you run into any issues, you can always contact, once again, our support team at achieveondemand@theons.org. All right, so I'm going to go ahead and share my screen. Make sure I'm sharing the right one. Okay, so when we are first going in to register into Achieve OnDemand, you're going to use the link that Don will be providing out via the confirmation email. It's important that you use that specific link because we do have the National Achieve OnDemand Open Access Portal. And we do have a number of other states and program models who have engaged with us who have their own custom portals. And so all of them have kind of a similar portal for this to sign up for the course, but you can definitely tell where you are because we try to make it very visible that this is the portal for the Minnesota Department of Health. So if you get to this site and you're not seeing the portal for Minnesota I'm visiting, you're not seeing the logo for the Department of Health, you may have gone to one of the other access points. That's not a problem. You can always reach out to us and we can get you the correct portal. And even should you just go ahead and register and not wind up in the right audience, it's really easy for us to fix it. So like let's say you went through and wound up in Alaska's group or you went through the national portal, you can always just contact us at achieveondemand@theons.org or give us a call at the hotline, and we can get you switched over to the correct audience really quickly. And once again, as a call out here, as Don mentioned, we have our support information right here on the bottom of the screen. All right, so once we've gotten to the right spot, the first thing we're going to want to do is create our account in the system. The way we do that is by coming to the register button here and clicking it. That's going to take us to the registration form. Once again, you can tell you're on the right registration form because we have the Minnesota Department of Health logo up top. And scrolling through, it's a pretty standard user form creation, first name, last name, email address. These little icons here you may not have seen in other spots in the web, but these are just pop-ups that will open up a window that lets you pick. So let's say I'm with Family Connects, and my service delivery type is home-based, and my primary position is a home visitor. And then organization or site name, that's the name of your program or your group. And then you'll enter in the other information. And then we have a few questions here to help us with making sure that as we manage information for your account, that we're able to get you the best services. So for example, if you're a social worker or a nurse and you require CEUs, answering this question will help us track that to get any relevant CEU information back to you and logged in the system. And then down here, you'll just enter in your password. The passwords for Achieve OnDemand are not as they don't have to be as cryptic or as built as you might have for your financial institution or for any other more major secure areas. But we do recommend having a unique password that isn't easy to guess and is not and it can't match your username or email address. So once you've entered in your information, you'll click Login. That'll log you directly into the system, and you'll be able to get rolling right away. In this case, I'm going to cancel out just because we're not actually creating a login or user for this go around. And when I cancel out, it's actually going to take me directly to the login screen. And I'll note on this screen, once you've created your account off of that previous portal, you actually don't ever really need to go back to that portal. Just to demonstrate that portal again, I'll jump us back there. So in terms of sequence, this is where you'll come to create your account. We do have a link that can take you to the login screen, but as I mentioned, you don't ever actually need to come back here. If you want to bookmark this and have this be where you go, you can. But after you've created your account, the login screen is really the only place you ever need to come back to get into Achieve OnDemand. So if you want to only have one bookmark, this is the one I would bookmark. If you're using Chrome, and we definitely recommend using Chrome as the courses have been most optimized for it. I say that acknowledging that you may not have the options of using that based on your agency's technology protocols. So the courses do work in Safari, they work in Firefox, IE, Edge, any number of the browsers. They're just not optimized for those. And if you run into any issues getting them to work in those systems, once again, feel free to reach out to us. If you are using Chrome and you want to bookmark and you've never done a bookmark in Chrome before, it's really easy. You can just come up to this, the browser bar, and click the little star icon, and you can set it for, you can actually rename the bookmark to whatever you want. You could rename it Achieve OnDemand, and you can store it into folders, or you can just place it up on your browser bar up here. All right, so, and in terms of what this process may actually look like for you going through, I'll go ahead and log in. So as I mentioned, when we do the registration form, it will auto log you in off of that piece. So if you want to kind of the next step, if you want to automatically set up your bookmark of the login screen, you could just come up here and log out, which will drop you here. You'll enter your email and password. You can save those if you want. If you prefer not to, if you're on a public computer, definitely don't recommend that. But you can come up here and bookmark, and then you can sign back in to go dive in and start registering. All right, so now we are into the system. From here, we're going to be starting on the dashboard. The dashboard provides you with a number of access points to get to the catalog and to get to your transcript. Those are going to be the two primary points that you're going to be using to navigate through the system, enroll into courses, and then access the courses. On here, we have the quick links to your catalog, some quick access for getting to quick links to the transcript, quick access to the catalog, some additional information on how to access your certificates of completion, browser requirements, some tips for exiting some of these self-paced courses, some information on the webinars and things like that. We may, if there's announcements that we need to get out, we may update some of this information, or if there's specific things that Don or the Department of Health want you to be aware of, that they really want to get messaging out to every Achieve OnDemand user, we might have a pop-up message that comes through when you log in. Those, similar to any pop-up message, will just have a click to get rid of, and you can also say, like, don't tell me this message again, a little checkbox on there. Okay, so from here, you'll note this user already has a number of things registered. When you first log in, the My Professional Development widget here will be closed, or I'm sorry, will have no information in it because you won't have any courses signed up for. And I will note with this widget here, we're only going to see the 5 most recently registered into courses. So, but before we get into that, let's talk about how we register courses. You have 2 ways of getting there. You can either come and use the widget over here to access, or you can use the top navigation bar. It's really dependent on your preference. The top nav bar will let you navigate around, and let's say we wanted to use the top navigation bar to get to the catalog. I could come up to Professional Development, go to Browse Professional Development Catalog, click it, and that's going to take me to the catalog. I'll also show you the way to get there through the widget. So I'm going to jump back to the dashboard. And let's say I wanted to get into the catalog, but I wanted to only look for courses related to domestic violence. So I can click the domestic violence option, and that's going to filter everything down to just domestic violence for me here. So I can see that right now, currently in the catalog, there's 1 self-paced course and 2 webinars that are related to this. If I decided, okay, that's great, I've seen that, I want to clear the filter, I can always come here and click the little X, and that's going to give me the full listing again, so I can scroll through. We have a number of filters here on the left-hand side that you can use to also apply. So if you just want to look at self-paced courses, you can do that. And let's say I only want to look at self-paced courses for supervisors. Oh, I guess, well, that's a step on me. We can only apply one filter at a time. So we can look at self-paced course, or we can look for supervisor, and you can see. So we'll go ahead and we'll clear that out. You can also filter by the types down here. Also, if you, say for example, you were looking for webinars and you were trying to figure out specific dates, you can either click into the webinar itself, and it'll have all of the upcoming sessions that are available here with the dates listed. Or if you're more interested in finding a webinar using the calendar, there is the ability to define a date range, or you can just click this View Full Calendar link here, and that's going to pull up all the webinars that are coming up. So if I go, let's say I go to June, and I'm looking through, I can see, let's stick with the idea that I'm a user who's definitely interested in learning more about domestic violence and home visiting, and I can see there's a session coming up on June 26th. I can click on that and go into view the session. I can read information about what's going to be covered in the session, information on the instructor, some information about training registries and completion requirements, and then I can request to register in. And I'll note another good way to check to make sure you're in the right spot. So remember, we talked about making sure to register into the Minnesota group. If you get to this point, you can see up top the price listing, the discount, and that it should be a $0, and this should say request. If you get to this point and this is not showing it as $0, if it's showing at 25, or this is saying add to cart, your account is in the wrong audience and we need to switch you over. So that's at the point where you'll reach out to the support team and we can easily get that fixed to you. But I made it to this point, and if I click request, I can see that it is now taking me to my transcript, and the course is now available in my transcript. Let's say I'm really excited and I want to see the session right away, and I click launch. Well, the system is very happy that I want to engage in the webinar. Unfortunately, it's scheduled in 42 days. So the webinars, once again, they're on a scheduled date. You can click on them. It's not going to cause any issues. It's not going to remove you from anything, but it will give you a countdown to let you know when it opens. The webinars do open an hour ahead of when the session starts, so you can log in early and if you want to be situated, and it gives you a nice countdown to let you know when that one's coming up. All right, let's jump back to the dashboard. And let's say now that I've signed up and I can see here that that webinar session has been added to my widget. Let's say I realized, oh, you know what, I'm going to be busy on the 26th. I can't do that one. I could click the withdraw button, and that would actually withdraw me from the session. It would remove it from my transcript, and I wouldn't have to. I could go and register for a later one as it came up. And let's say I still want to stick with this. So let's go ahead and click the withdraw. I'm going to say other and submit. And now it is out. But let's say I still really want to go in and take a webinar. So I'm going to click domestic violence. And I know that I couldn't attend that impact of domestic violence on children webinar, but I'm really interested in taking this domestic violence and safety planning. So I'm going to click that. And scrolling down, if you remember from when we went in via the calendar view, the buttons were up top. Since I'm going into the session out of the catalog, all of the available sessions are listed here. So if you go into the calendar, it's going to take you to a specific date instance, so you don't have to pick from the various options. If you want to see all of the dates that are available, you can always go in via the catalog and see the webinar section here. and scroll down, and I can see there's one on August 22nd, October 17th, and then January 28th of 2020. In this instance, I think, great, August works for me. I'm going to go ahead and request into that. And similar to before, it's been added to my transcript. And if I were to jump back to the dashboard, I can see it is also now in my professional development widget. Okay, so I've signed up for a webinar, and I know that one's taking place in August. In the meantime, I think I'd like to get started with working on the self-paced course for domestic violence. So once again, I'm going to jump in using the filter, or let's say if I'd come in using the top nav, I could come here and filter down by domestic violence as well. And here's our self-paced course. I'm going to click on that. And I can see it's given me a description of the course, some information on the alignment to the advancement of infant mental health and the competency areas that this course satisfies, and similarly, information on the training registries and self-paced course completion requirements. With this, I can just click launch, and it's going to sign me into the course and start it right away. Once again, if you get to this point and it says add to cart, or you're seeing anything that asks you to pay, please reach out to us because we can fix that to make sure that you can just launch and be part of the Minnesota audience. So in this case, my user definitely wants to sign into this and get started. I'm going to click launch. And the course will open in a separate window, and we'll start loading. Now, if you get to this point and you're seeing the little swirl going through, you may need to enable Flash to run. So that is, Flash is a technology that's used to deliver online content. We are currently in the process of updating to move that to HTML5. It's a lot of technical lingo you don't need to necessarily worry about. Just know that in the meantime, there is this additional step that you'll need to do if you're running into a situation where it's loading and it won't resolve. But we are working with our production team to update that to remove this step for you. So to run Flash, you can actually do that in Chrome by coming up to the little lock icon in your browser bar. And you can see I've got Flash here, and if I set this to say allow, and then reload, it'll ask me if I want to start from the last page I visited, and the course will start running. If you get to this point and you open the little lock icon and you're not seeing Flash in the options here, you can also click this icon here, which will open a window here, and Flash should be in the list here. Once again, if you are experiencing any issues getting that to run, please let us know. We will gladly help you out with getting that to run through. I will note that Chrome does not save that configuration when you fully shut out of Chrome. So if I was to close out of this and do some other stuff but never actually fully close Chrome, it's going to save that configuration the whole time. But let's say I finished working on this course for the day, shut everything down, came back a week later, launched it, I'd actually need to re-enable that during that instance. So it's a bit of a extra step, but once again, it only takes like 5 to 10 seconds. Click there, click allow, and reload. And we are in the process of updating this so that you won't even have to do that in the future. All right, so once you get into the self-paced course, you can use a few of the options to navigate. There's a little help icon up here that's going to tell you some of the navigation features. The menu shows you the course list, and you'll note right now I can view everything in the introduction, but I can't navigate any further. You will have to work through the course sequentially. And then there's some additional tools, including, and I want to give a shout out for, there's a reflective worksheet in the resources. The reflective worksheet is tracking your progress through the course and your responses. This is a really helpful tool that a lot of users have taken with them either into reflective supervision, or if programs are working on this as a cohort, these have been really helpful discussion pieces for peer learning. So this will track your information. and you can print it, save it as a PDF, and store it on your computer. So this is definitely a resource for you to have as you work through the course. And then I'm going to actually exit out of this course. So really quick, this is the layout of about half of our courses. And then I want to show you one of our other courses just so you have an idea of what that one would look like. Let's take a look at challenges in substance abuse. All right. So some of our courses will have this frame up front. The flow is basically the same, but these have similarly a dashboard up front that will let you know where you can jump to the modules themselves. And these white progress bars will turn yellow and then green as you complete the modules. And if I were to jump into the course, I can see that the frame is fairly similar, but has a few minor differences. To access the reflective worksheet, I can just come up to the top here and click reflective worksheet. The navigation bars are down on the bottom. These little dots show you how many slides are in each section. The slider dock will let you pull up the audio bar, the transcript, the help graphic, and the glossary. And then this shows you the course map similar to what we saw in the other course. And if you ever want to jump back to the dashboard for this course, you can click it here. So that is what those look like. All right, so we've gone through the process of creating our account. We've gone through the process of registering into a webinar and into a self-paced course, and done a little bit of navigating around the self-paced course. So let's say my user has gone through and completed a course. Now that the course is completed, I want to go and access my training certificate. So the way we'll do that is by coming into the transcript. And actually, I'm going to go back to the dashboard to show you how to access the transcript. So you can either launch the courses. If you've got the courses, you can access the 5 most recent ones from the My Professional Development widget here. Or you can access your transcript by clicking either on My Professional Development here or coming up to the My Professional Development link here. So I'm going to click that, and that takes me to my full transcript, which has all of the trainings I've already registered into. And you'll note these are my active trainings. If I want to view the courses I've completed, I can click on the drop down here and go to completed. And here I can see this user has completed the Building Engaging Collaborative Relationships with Families course. And then we have the option to view the certificate. If I click this link, it'll open a separate window. That has my completion certificate. And that has the name of the course, the amount of hours associated with, the date completed, and if there's any additional information that is needed, let us know. Say if you need to have a registry number or something else like that listed, we can work with Dawn to get that implemented for the Minnesota audience. This can be downloaded or printed. So if you want to have a digital copy or a paper copy, it's there, and it will stay in your completed section. The other thing I do want to note, even after you've completed the courses, once again, you can get back into them and work through them at any time. The way you do that is you come to the little drop-down icon here, and you just click Launch. So if I were to click Launch, it's going to go ahead and kick off that course for me again. And we're back into the course. All right. So with that, we've basically done a full tour of the system. I'm going to stop sharing my screen for a second. We're going to go back to this view. I'm going to open it up for questions in a minute, but I did want to just cover a few of the frequently asked questions we get, just in case those have already popped in your mind. The first being how to access the courses. Hopefully the demo showed how to do that, but I will note we have some support guides that we will be able to share out. If you would like to have something beyond this video demo, we do have PDFs that guide you through the process as well. The next one is, why am I being asked to make a payment? Well, if it is asking you to make a payment, it means somewhere in the process you you wound up in a different audience than the Minnesota audience. In that case, you can just reach directly out to our support team, and we can get you transferred. How long are the self-paced courses? Once again, it's variable. You may be able to move through them quicker than others, but you're not required. There's no timer on it that says you have to do it in a certain amount of time. So some folks enjoy taking more time, going back through a number of the slides and reviewing them, or coming back to them later throughout the year. It's really up to you, but as a build, they're about 3 hours each. Can we complete self-paced courses as a group? That's a great question, and it's one that we at Achieve OnDemand are fully endorse the idea of folks working together as a coherent training development plan. We love the idea of peer learning and reflective sessions. I will note, to get credit in a course, we want everyone to have their own license and move through. Also, for allowing of CEUs and things like that, you have to complete the course on your account to receive completion credit. So we definitely recommend, if your program, everyone wants to sign up into the system, create their account, and then everyone take the domestic violence course kind of in a cohort session. Everyone would register in, work through, and then possibly meet together for collaborative learning sessions. We also are very much in favor of groups attending the webinars as groups as well, but once again, we ask that everyone register in so that we can properly track your attendance and completion. And then, can I use my same account if I already had one? If you already have an existing Achieve OnDemand account, yes, very much so. We can shift you over into this audience. You'll just need to verify with Don that you've been accepted into the Minnesota audience, and then contact us at Achieve OnDemand, and we can easily transfer your account. All right. So I will now move to opening up the floor to questions and answers. And I'm going to take a look through to see what we've had in. Okay, so one of the questions from Christy was, if we decide to view a webinar as a group, is there a way for each member of the team to receive a certificate for attending the webinar? Yes, definitely. We ask, once again, everyone register into the webinar. Send us during the webinar. We'll ask out and ask if folks are attending as a group to put their names into the chat so that we can track them. You can also just send us an email ahead of time letting us know that your group will be attending and listing out the participants. And then we just automatically can track it on the roster. So definitely something that we're very much in favor of. We feel that there's a lot of value to a group doing that and having kind of discussions alongside it. If you have the time, it helps the process by emailing us ahead of time. If you can't, we'll flag it during the webinar and track attendance. All right. Let's see. Megan asked, if I'm a supervisor, how do I view my staff's progress? Do I have to make an account? Does it have a different setup? We will be sharing some tools with Dawn that will help to track everyone's progress that she can then provide out. Supervisors in the system don't have a direct view into their specific participants or staff's participation, but we do have exported reports that we can filter out. So Dawn will have availability of those, and we'll be able to pass them out as we go through. All right, let's see. Ma asked, are there any agreements with HFA so these courses meet HFA training requirements? Give me 1 second. The courses have been crosswalked to the HFA training requirements, as well as most of the program models and other governing competency models have crosswalking for the Achieve OnDemand courses. We can share those out, and we'll check with Don to make sure that if there's any particular things that your audience needs, to see if there's ways that we can better meet those specific requirements. And then Ginger, we will definitely send out the PDFs. Also, we have a question on the ounce-taking topic suggestions. Yes, we are very much always interested in hearing what training and development we can build to provide better resources for you. We are currently in the process of laying out our product roadmap for the next couple of years, which will include identification of new topics and our build for that. When you complete a course, actually, that's a really good piece that I probably skipped over in the process. So let me go ahead and share my screen again. So I'm going to jump back to the dashboard. And when I complete any of the courses or the webinar, this launch button will change to a pending evaluation button. What that means is you'll have the opportunity to go in and give us a very short, there's a short end of course evaluation that is for both the self-paced courses and webinars, where we'll ask your feedback both in terms of satisfaction with the course, some information about what you've learned from the course, and areas for suggestions. So that's definitely an area where if there are topics that you need, please feel free to let us know in that section. Or you can always either pass kind of requests on to Dawn or email us at Achieve OnDemand with suggestions, and we will put that into our tracker to see when we can implement and build those trainings. Okay. The next question was regarding group participation, would it only be those who have a license who got the certificate? The answer is yes. We can only give certificates out to participants who have a license in the system, and furthermore, participants who have a license in the system and have registered into that specific training. All right. I'm going to give us a few more minutes for questions. So if you're still thinking of one or typing, feel free to keep going in that. Or if you would like to unmute yourself or raise your hand, it looks like Nidra raised her hand. So I'm going to Nidra. I'm going to unmute you just to see if you wanted to ask a question. You are unmuted. Nidra, did you have a question? Okay, I'll put you back on mute. All right, let's see. Again, who specifically should we email if our team wants to do a webinar as a group with only one license? Great question. You can email, I would say in that instance, you can email Achieve OnDemand at theounce.org to let us know you will be attending as a group. Once again, we can't, if you don't have a license through the Minnesota Department of Health, we can only give the certificate to the person who's participating. If your group is looking to acquire more licenses, that's where you'll contact Dawn directly, as Dawn is administrating the licenses. I hope that was clear. If not, let me know and I'll cover it again. Great. And Dawn, were there any other things you wanted to address or any questions that you wanted to ask out?
I just have two quick thoughts. Sorry, my computer. Part of the reason that there are reports in Minnesota. We'll get them, and we'll be working with Achieve OnDemand. We know that people record the name of their agency different. I can't tell you how many. One agency could come in, 7 different ways. It's the Minnesota Department of Health, it's the Health Minnesota Department of, it's MDH, it's MN Health. Everyone has a different way of putting it, and we're going to be working with Achieve OnDemand to sort through that. But if at an agency level, if you want to tell your staff, put down, MDH or put down Minnesota Department of Health, that'll just make sure that we get all of your people. We don't think it'll be an issue, but that's part of what we have to do is sort of sort through and make sure that every agency's, that we don't have stray individuals who are like, I wonder what they belong to. And then the other thing is right now we really do have like 310 licenses left. So don't hesitate to sign up because I think we weren't sure. We were just like, are these going to go all at once? Are we going to have 500 requests? And while we're sure we'll, eventually give them all out, it's certainly people, I think, because we're asking a little bit of a commitment to actually take some courses. But if you have someone who really can, at least commit to trying to take one course and one webinar a quarter, have them apply to sign up. We certainly have ones we can give out now. And that was my only kind of extra comment.
Okay, great. Thank you for pointing that one out, Don. That's really helpful. All right. Well, it looks like we've got all the questions out that everyone has at the moment. If any come to mind, please feel free to reach out to us at Achieve OnDemand at theounce.org or give us a call at 312-481-8859. And as a reminder, we will be this session was recorded. I'll be sharing the link to the recording with Don, and also share the support guide resources. And we will be looking forward to seeing everyone get into the system and enjoying the courses.
And Michael, this is Don. Is it so? It looks like the email was successful in sending out. So at 10:30, hopefully everyone who's approved. Mm-hmm. If you didn't get one, I had 2 email bounces, so those people I'm going to contact, and then everyone else who was already approved got it. So can they go in right now or at 11
Yep.
or?
It is open now, so
okay,
everyone
perfect.
You're free to start registering. Oh, we did have a question from Michelle. When does each quarter start? So Don, I would say that's actually a question from the Minnesota Department of Health perspective.
Yeah, I think we're kind of starting in the middle of May, so we don't expect like someone has to take something. I think we'll follow kind of the calendar year. So really, what we'll be looking for is, ideally someone might take one between now and June 30th, but with vacations and school schedules and everything, at least explore, get your account set up. We'll really start kind of watching this starting in July. So it'll be the July, August, September, October, November, December, kind of the typical quarters that we look at. And again, we know starting is slow, right? People have best of intentions. We just want you to make a commitment. So don't worry that we're going to be like, Michael, you have not taken a course. But we might be wondering, like, hey, what's going on? Are you not finding anything? Are you having trouble registering? Are you trying to take it? Some of these are 3-hour courses, so to try and take it all in one setting might be kind of difficult for a home visitor. So, we can work with you to think about how you can break it up. And they're intended to be broken up. It's not meant to sit down for 3 hours and take the full thing. That's why it's self-paced. So.
Great. All right. Well, thank you, everyone, for joining today. And Don, did you have any closing thoughts before we end the session?
No, I'm just happy learning, everyone. We're happy to offer this, and like you said, normally if you signed up on your own, you'd be charged for this. So we're glad to be able to use our funding for training to make this more available, and particularly for especially some of our remote areas. We're hoping that this fits some of your need. We know in person is always better, but at least this gives you some access to some courses. So we'll be looking forward to hearing what everyone thinks and the progress people make. And so, yeah, we're just excited. Thank you.
All right. Great. Thanks, everybody. Have a good day.